Hi, if you reach this video, it's probably because you live in New Hampshire and you have questions about Medicare. I'd be more than happy to help show you some information, answer some questions, just as if I was sitting across from you at your kitchen table, like I've done with thousands and thousands of folks across New Hampshire, Maine, and Massachusetts. So without further ado, let me go ahead. I'm going to share my screen with you, and we'll start talking and we shall go from there. All right. All right. So what you should be seeing here is this page actually comes directly out of the Medicare and You booklet, which just about every senior gets approaching 65 and after 65 every year. The Medicare and You booklet basically tells you just about everything about Medicare. The only problem with it is that it's very dry, it's confusing, and most people don't read it. I can help make it easy for you. But working and specializing in New Hampshire is something I've done for a number of years, really since 2010. We've helped people on board with Medicare in New Hampshire, Maine, Massachusetts, and actually quite a few other states. But New Hampshire and Maine is our specialty. So the question I get a lot, or from most folks, I would say, is, I'm turning 65. Um, do I need Medicare Part A and B? And if so, what's the process behind that? Okay, so just about everybody who has turned 65 will automatically be enrolled in Medicare Part A. And for most people, there's no premium cost for Part A. Now, Medicare Part B, on the other hand, is really the bulk of what we call your medical coverage. Whenever you see a doctor, a nurse, you have blood work, you have x-rays, you have surgery. Um, and Part B, for most people coming into Medicare this year, it costs about $174 a month. If you already take Social Security, that $174 will be automatically deducted out of your Social Security. If you do not take Social Security, then you will be billed on a quarterly basis that 174 per month direct paper bill from Medicare. Um, and they do give you other options to automate that until you're in Social Security, so that you don't have to write a paper check out every 3 months. Um, but anyway, I don't want to digress too much. What I really want to talk about is, when people come in, when they start considering Medicare, first of all, they think, okay, so what's my choice with Medicare? A lot of people, might be continuing to work. So a lot of people will say, hey, I'm going to continue to work. Um, and I'm thinking I'll just keep my work coverage. Okay, well, that's an option. But I will say, for most people, probably 9 out of 10 times, um, that it is in your best interest. Uh, it is usually a better value, and you're getting better insurance coverage by going with Medicare. Um, and of course, the choice then becomes, do I choose traditional Medicare and adding a supplement and adding a prescription drug plan, or do I choose the Medicare Advantage option? Um, so let me be clear that, again, Medicare Part A is automatic and will sit in the background for just about everybody until you activate your Part B. Some people will decide to continue with their employer coverage for whatever reason, sometimes for many years until they retire, and then they will activate Medicare Part B. So some people might turn 65, they get Medicare Part A, doesn't cost them anything, it just sits in the background. Then they retire at 70. Now they activate Part B. They're going to lose their insurance coverage at work because they're retiring. And they're going to speak with me or someone like myself, and they're going to figure out, okay, do I want to add what's called a Medicare supplement plan, or do I want to go into what they call a Medicare Advantage plan? Um, So let's say that you want to stay within traditional Medicare. You have Medicare Part A, you have Medicare Part B. Um, Good coverage. The problem is Medicare Part A and B only cover 80% of your medical costs with no cap on what you could owe for that 20% left over. So for instance, if you have a $100,000 bill, Medicare in essence would cover 80%. you'd be left with 20% left over, which in that case would be $20,000. That's not a good thing. That's why most people will either get a Medicare supplement plan or a Medicare Advantage plan. Now, Medicare Part A, again, there's no cost. Medicare Part B, for most people coming in this year, it's about $174 per month. Now, add a Medicare supplement plan in New Hampshire, I'd say generally speaking for this year, depending on the type of plan that you want, you're probably going to be in the range of $125 per month, um, maybe up to a couple $100 per month, depending on your type of plan and your age. Of course, part of what we do as a service, and that's a no cost service for people, is help them find the best plan at the best rate and help them get enrolled. So, what a good Medicare Advantage plan, I'm sorry, what a good Medicare supplement plan does is it'll fill in that entire 20% gap that's left over from Medicare Part A and Part B. So, in other words, if you go into the hospital, you have a $100,000 bill, Medicare Part A and B pays its 80%, your supplement picks up entire 20% that's left over. And a lot of people don't know that Medicare Part A has a deductible which hovers around $1,600. Medicare Part B has a deductible which hovers around $240 annually. Um, so if you go into the hospital and you don't have a supplement plan, you're going to be responsible before the 20% portion even kicks in. You're going to be responsible for a $1,600 deductible. So that's why having a supplement or Advantage plan is so important. So what we help people to determine is whether or not staying with original Medicare and adding a supplement is the best choice for them, or whether or not going to a Medicare Advantage plan, which I'll explain now. We help them decide which is the better path for them. So um, just because Medicare likes to make things confusing, Medicare Advantage is also known as Medicare Part C. Why they explain it that way, who knows? But if you hear that term, you'll know that they're referring to Medicare Advantage. Generally speaking, um, let me go back to original Medicare and your supplement for a second. If you have original Medicare A and B, and you decide to purchase a supplemental plan and a prescription drug plan, um, yes, it's going to cost you more out of pocket for premium per month than it would if you have a Medicare Advantage plan. But you're going to have a completely open network with Medicare. You're going to have no copays, no co-insurance, no cost sharing, and your only deductible out of pocket per year will be your $240 deductible once per year, which will be your Medicare Part B deductible. Your Medicare Part A deductible, the big deductible, will be covered by your Medicare supplement. So if you're really looking for the best coverage, the most thorough coverage, you have medical concerns, then your most thorough coverage certainly is going with Medicare Part A, Part B, traditional Medicare, adding a prescription drug plan, which we help with, and then adding a Medicare supplement plan, which we help with. Reverse a little bit here. Um, Medicare prescription drug plan is probably going to run you somewhere between $10 and $30 per month for most people. A Medicare supplement plan in New Hampshire is going to run anywhere between $125 to $200 a month for most people. And of course, we help you find, the best company, the best plan, the best rate. But I will say that if you have original Medicare and you add your prescription drug and your supplement, you do have really the most excellent coverage. The downside is, you're having to pay for that. So you're going to pay your 174 per month for Medicare. Then you're going to pay, say, another $175 a month for a supplemental plan. And then you're going to pay, say, another $25 a month for a drug plan. Now, that's going to add up 175 plus 175 plus your drug plan, so 375 a month. So you're going to have 174, let's call it 175 for Medicare. You have, let's just say 175 for your Medicare supplement and say 25 for your prescription drug plan. So that would put us at 350, $375 a month is what you're paying in your premium. But you do have the Cadillac coverage. You can go to any doctor, any hospital. You don't need referrals. You have no co-pays, no co-insurance, no cost sharing, and you're only out of pocket for anything medical the whole year, essentially, will be your Medicare Part B deductible, which is a one-time deductible, $240 per year. So now some people hear that and they say, well, I'm trying to keep my costs down. I'm healthy. I've heard about Medicare Advantage. I know a lot of people that have it. And yes, tons and tons of people have it. These days, I probably have even more clients that have chosen Medicare Advantage and they're quite happy with it. So, what is Medicare Advantage? So, Medicare Advantage is basically a situation where Medicare itself has contracted with these independent insurance companies. It could be Humana, Anthem, United Healthcare, Martin's Point, uh, Aetna, Cigna, etc. And they actually uh, pay these plans a certain amount of money to administer a Medicare benefits package under their umbrella for you. Um, Medicare loves it because they're basically passing on the administration of benefits to these independent companies. These independent companies like it because they get business, and people love it because they're getting a much more robust plan than they would with just Medicare alone for zero additional premium. So it is a tremendous value. And how does the Medicare Advantage plan work? Well, the easiest way to understand it is a Medicare Advantage plan works very similarly to um, how plans that you've had through your employer for many, many years, HMOs, PPOs. The networks are very, very good. There's zero deductible. There's, in most cases, I will say, in most cases, zero deductible. There's zero premium monthly. So, in other words, you're going to pay your 174 per month to Medicare for your Medicare Part B. Again, no cost for Part A. And then there's no additional premium charge in most cases for your Medicare Advantage plan. So, what are the upsides of a Medicare Advantage plan? Well, number one, you're saving the money you'd otherwise be paying in premium to a Medicare supplement plan and for a standalone prescription drug plan. So you're saving that money. So that's a couple $100 a month on average. So that comes out to $2,400 a year you're saving. Okay, so what are you giving up because of that? Well, your network is going to be very, very good, but it's not going to be quite as good as Medicare itself. So if Medicare accepts 100 doctors in an area, your plan may accept 90 or 95 of those doctors. You still have a lot of choice, but it's not going to be quite as comprehensive. And people also really tend to like Medicare Advantage plans because it puts all your Medicare coverage under one umbrella. So let's say, for example, you have a United Healthcare Medicare Advantage plan. Well, now the only card you need is your United Healthcare Medicare Advantage card. You go to the doctor, you go to the hospital, you go to urgent care, you go to your pharmacist, you go to your chiropractor. All you need to show them is that one card, and everything is administered and paid through United Healthcare. Now, the other big difference with Medicare Advantage is you will have co-pays, you will have co-insurance. So, for instance, if you have original Medicare and a supplement, on the other hand, you're going to, uh, like I said, pretty much have nothing out of pocket for anything. Okay. If you have a Medicare Advantage plan, typically your primary care, your annual physical, your annual preventative care is going to be no cost. But what happens if you need a surgery? Okay. Well, on most Advantage plans, you're going to pay about $300 or $400 flat copay for a surgery. What if you have to take an ambulance ride? Well, again, most plans you're going to have to pay around $300 for an ambulance ride. What if you have to go to urgent care? $50 copay, let's say. You have to go to see a specialist. Okay. So someone not primary care, you see a dermatologist or cardiologist, yeah, have a $50 copay. So That's how Medicare Advantage works. Now, um, for the most part, your costs are pretty well controlled with Medicare Advantage. Although if you do end up in the hospital, let's say for a week, you could easily be $2,000 or $3,000 out of pocket. So you have to be prepared for that. But then you can also ask yourself the question of, how often have I been in the hospital? How often are those things likely to happen? And people tend to weigh, both original Medicare with a supplement and Medicare Advantage uh, against each other for those types of factors. So let's hone in a little bit on what are the benefits of Medicare Supplement and then the benefits of Medicare Advantage. So what are the benefits here of owning Medicare Supplement insurance? Okay. Low out-of-pocket costs. Okay. So of course, with the Medicare Supplement plan, you're going to have a premium for your plan. Like I said, somewhere between $125 and $200 a month. But you're going to have virtually no out-of-pocket costs. So you go into the hospital, you stay for a week, you have a surgery, your only out-of-pocket cost is likely to be, if you have a Medicare Supplement Plan G, your only likely out-of-pocket cost would be what they call your Part B deductible, which is $240 one time per year. Um, Secondly, in with Medicare Supplement, you choose your doctors and hospitals. So virtually all doctors and hospitals accept Medicare. That means that you can go to them. It does not matter who you have or which company you have for your Medicare supplement plan, whether it might be Cigna, Aetna, United Healthcare, Humana. By law, if you have Medicare and a supplement plan, by law, the provider has to accept your Medicare supplement insurance carrier, no matter who that carrier is. So that's something to keep in mind. A lot of people get confused over that point. But the bottom line is if you have Medicare and a supplement, your only concern is does this doctor or hospital accept Medicare? If they do, you're good to go. Your coverage, number three, your coverage on these Medicare supplement plans is guaranteed renewable. That means that the company cannot take it away. They can't cancel you because of your health or too many claims. Um, and Pretty much the only thing they can do over the years, and they do, is to raise your premium. And that's something that you want to keep an eye on, just like you might keep an eye on your auto and home insurance. But that's something that we as an agency also help people do. We make sure that you get the best rates initially, and then we keep in touch, down the road to make sure that you're getting competitive rates all through your retirement. Um, Providers accept patients with Medicare supplement insurance. That's kind of a little bit redundant, but again, any place that accepts Medicare, again, by law, they have to accept your supplement that goes along with it. Um, and your coverage goes with you. I won't say in all cases, but in most cases where I have a couple that is spending 6 months in New Hampshire or Maine or Massachusetts, and they're spending the other 6 months in Florida or Arizona or the Carolinas, um, it's ideal to have traditional Medicare with a supplement. You're just going to have better, more comprehensive care in both areas. You can have a Medicare Advantage plan and be okay in both areas, but if you want to know that you're going to have coverage that's just as excellent in New Hampshire as it would be in Florida, that staying with traditional Medicare and a supplement is definitely the way to go. Now, let's speak about Medicare Advantage. So, what are the benefits of Medicare Advantage? We talked a little bit about this. Um, Medicare Advantage has all the benefits of original Medicare. So by law, if you sign up for a Medicare Advantage plan, by law, the plan has to cover everything that would normally be covered under Medicare Part A, Medicare Part B, Medicare prescription drug in most cases. And uh, people tend to like these Medicare Advantage plans. To be quite honest, most of them are zero premium. People love that. And people like the fact that everything is under one umbrella. Your vision, your dental, your hearing, your prescription drug coverage, your medical coverage is all under one plan. That's quite nice, and people do like that. Um, and to just mention again, uh, these extra benefits such as dental, vision, hearing, gym membership, these things are not included with Medicare and a supplement plan. So keep in mind um, that if getting some basic dental, basic vision, basic hearing, and then some extra things, gym membership, etc., if that's really important to you, then definitely take a look at Medicare Advantage and we can share some plans with you. And then lastly, um, all Medicare Advantage plans are required to have a maximum out-of-pocket limit to protect you. Now, maximum out-of-pocket limit is kind of the reverse of a deductible. There's no deductible on these plans, which is a good thing. There is a maximum out-of-pocket limit. It typically hovers around $7,000, and uh, that would be what we call your kind of worst case scenario. So if you had a Medicare Advantage plan, you'll likely get great care. But if you had a situation where you were in a hospital for a week, you had all types of surgeries and treatments, you were in a rehab center after that for months and months, you could have a situation where one year you end up five, six, $7,000 out of pocket. But to to feel a little bit uh, better about that, Medicare makes these companies have what they call this maximum out-of-pocket limit, and which is a good thing because it protects you from really catastrophic, being responsible for what we call catastrophic costs. Um, so the way that people look at it is they say, okay, just to kind of summarize everything, what are your choices again? Well, you can go with when you come into Medicare and you want Medicare as coverage. You're done with your employer coverage. You're done with uh, you're done with employer coverage. You're done with whatever coverage you've had before. Medicare is you're going to have two choices with Medicare. Again, original Medicare on the left side of the screen, Medicare Advantage on the right side of the screen. So uh, Medicare Part A and B, keep in mind you need to have Part A and B in place in order for us to put you into a Medicare Advantage plan. You need to have Part A and B in place if you want us to sign you up for a Medicare Supplement plan. So, um, anyway, I hope this information has been helpful. Obviously, with Medicare, there's a massive breadth of knowledge. There's lots of questions. Um, and I will say that the service that we and others provide is worthwhile. There's no additional cost for the services of an independent agency and brokerage. We're more than happy to speak with you. Um, you can reach me always directly via phone or text at 603-969-7147. You can also go to CroninAgency.com and check us out there. But we'd be more than happy to speak with you, um, listen to your situation, give you advice, for instance, on whether it's best to continue with your employer coverage or to go to Medicare, and then from there decide, okay, is original Medicare with a supplement the best choice for you, or perhaps is it Medicare Advantage that's the best choice for you? So, and again, it is an important thing to work with an experienced agent or broker I'm going to because just to estimate these numbers a little bit for you, um, I will say that there is at least a couple dozen insurance companies that are offering multiple dozens of variations on Medicare Supplement, Medicare Advantage, and Medicare prescription drug plans in New Hampshire. So when it comes down to it, there's probably there's probably upwards of 80 different plans when you break them all down. The different prescription drug plans, the different Medicare Advantage plans, the different Medicare supplement plans. So, um, and I figure, we do what we do. We're experts in what we do, and there's no additional cost for you. We work for you and not the insurance company. So I tell people, you know, give us a call. Um, Usually the first call is just a few minutes over the phone. We'd be more than happy to help you. And if we just give you advice, and then, speak some years down the road, that's fine too. But please check out our website again. Give us a call if you need help. Otherwise, have a great day and thanks for watching.